Hello, I got a recent question that I thought was interesting. Doc, I had a facelift and it was unsuccessful. What do I do? Well, frankly, I don't know without examining you because plastic surgery, after all, is a visual sport. So one has to define what, first of all, unsuccessful means. Does it mean that you had a complication such as necrosis or a hematoma or bleeding or nerve damage? Was it unsuccessful because you had asymmetry, or is it unsuccessful because it did not meet your expectations? So that's important to define that first. It's important to ask what type of facelift did they have? Was it an endoscopic mid-facelift? A great permanent result type of surgery done with hidden incisions in the temples and the mouth. Now, that is not a tightener. It doesn't tighten the neck, but it's a reshaper, it's a glamorizer, and it has its appeal. And I do it on people as young as 28. So it gives you those almond-shaped eyes, it gives you beautiful cheekbones with your own natural tissue, etc. So if a patient was getting an endoscopic mid-facelift when they expected their neck to be done, well, that's going to obviously lead to a source of disappointment, and the patient would say, it's unsuccessful. Now let's go on to the actually most common facelift that everybody knows and loves, and that is a classic, yes, it's a boring term, facelift. That's a family of facelifts that involve incisions in front of and within and around and behind the ear. The incision or scar behind the ear reflects the redraping of the neck skin. The incision in front of and within the ear reflects the redraping of the facial skin. And it's not just as simple as that, because basically we want to get under the skin and tighten the muscles, so to speak. It's really not tightening those delicate muscles because you would permanently damage them. What we're doing is tightening the tissue that's intimately enveloping and fused to these delicate muscles. So you tighten the fascia, you're basically lifting up the duvet of deeper tissue, perhaps vertically or in the vector of the surgeon's choice, dictated by their better judgment, hopefully. And by tightening this fascia, which is the submuscular aponeurotic system, aka SMAS layer, you will in fact give the face another element of added firmness and tightness and elevation. Now, do you ever wonder why there's so many different types of classic facelifts? Well, it's because none of them work in 100% of people 100% of time. So you're going to have all these enterprising surgeons saying that they have now found the chalice of youth. Some patients who have such beautiful cheekbones and jawbones, you can get by with a really old-fashioned facelift, and the cheekbones and the jawbones do all the rest. They're great coat hangers, so to speak. Whereas other patients are not so blessed in the skull shape department, and they will have to get perhaps artificial cheekbones with implants, jawbones, fat transfer, etc. And obviously getting a more involved facelift. So facelifts in good, capable hands are very excellent at really tightening the neck, getting rid of the bands, as well as redefining the jawline, getting rid of these pesky jowls. But the one thing that they most often fall short of is smoothing out the mid-face. In fact, you will get a very smooth mid-face with smoothing out the nasolabial folds, which is, by the way, the mid-face, the area from the lower eyelids to the corner of the mouth, mid-face. So it will look good in capable hands right away, but I do tell my patients that after a few months there is that relaxation period after the honeymoon phase has gone. And so what happens is that some of the nasolabial fold returns. And as I've mentioned in previous videos, even children have nasolabial folds. It is unnatural to have no nasolabial folds. So this quest of getting rid of all your nasolabial folds is ultimately a futile one, and perhaps an unnatural one. You'll get painted into a weird aesthetic cul-de-sac, so to speak. Is that same patient saying that their facelift was unsuccessful because it did not tighten their neck, did not get rid of the bands, did not help their jowls, left them with asymmetries, did not give them a nasolabial free countenance? So it's important to define what that means, unsuccessful, and put it into perspective. After all, as the Chinese say, 80% of a problem is defining it, 20% is solving it. Thank you for watching.